If you're preparing for your MRCGP AKT or CSA, I just want to go through a few things that we have that can help you pass. So the first is to join the GP Training Support Facebook group and join over 12,500 other doctors who are preparing for their exams or have already passed them. So we have daily revision topics posted, concise summaries of important clinical topics, statistics, organizational for the AKT, but also we discuss different cases and scenarios for CSA. There's videos, there's articles, there's rapid reviews. If we look at the AKT now, our main AKT preparation course has been running for over 10 years. You'll get to cover the things that we know people find difficult, like statistics, and we'll try to make it easy. The things that we know people find boring, the organizational domain, but that if you learn it are easy marks. And then also high-yield clinical topics from past examiners' reports. These things are often retested. We'll combine theory with lots of practice. So there are 2 teaching mocks done in exam conditions where you'll have questions on screen, and we'll cover high-yield, high-challenge topics. And by assessing how you do, you'll be aware of what areas you need to work on between coming to the course and the exam itself. The next thing are our AKT webinars. So we have 3 webinars, one covering statistics, one covering the administrative or organizational domain, one covering all the high-yield clinical topics from recent exams. These are often frequently tested. Next, we've got our AKT revision. So there's over 1,400 questions, including a full 200 question mock. And then our latest product, our AKT 200. So this is basically 4 teaching mocks, 50 questions in each one, making a full 200 question mock done in one day. They're done on screen, and by going through the review of those 200 different topics, we will cover the sort of key things that will help you get through AKT. But you'll also get an idea of what it feels like to concentrate for that time, to manage your time, and we're covering 80% clinical, 10% stats, 10% organisation, the exact same makeup as a real exam. So that's AKT. What about CSA? Well, our main CSA course is actually a package that includes, before you come to the course, 2 hours of lectures covering all the key theory, including some videos, how to structure, how do examiners mark, what are they looking for, exactly what you'll see on the day, and also we'll look at how to sort of make the best use of that 10 minutes and what the 16 RCGP feedback statements mean. Then at the course itself, you're going to see 31 different role plays with both male and female simulators and 2 very experienced trainers. Lots of feedback. You'll have at least 7 cases that you'll take part in, including 3 full mock cases with lots of individual constructive feedback. So you have a clear plan afterwards. What do you need to do? After that, we'll send you 65 cases with detailed scripts, detailed marking schemes for the examiners for you to practice after the course up until the exam. And there's also some videos of high scoring consultations filmed in HD, and we'll send you some tips every few days and some sort of rapid reviews of important clinical guidelines. So the whole thing will help you prepare over a sort of 3-4 month period. We also have our CSA 100 Case Crammer. In one day, we break down 100 cases, look at the key things in history, the red flags, what to examine, how to manage it according to current guidelines, so the sort of management side of things, but also the interpersonal domain, how to explain things well, involve the patient, be person-centered, and deal with specific situations like home visits, telephone triage, palliative care, an angry patient, someone that wants to make a complaint, and so on, okay? And finally, we've got our CSA cases. If you don't come to the main course, you can just subscribe to the 65 cases with detailed scripts. They're arranged as 5 full CSA circuits. Now the last thing is going to be something that will help you for both AKT and CSA. So they are our clinical case cards. They're just out this year. So there's 112 topics that are reviewed in there, in 56 double-sided cards. So they're handy size, you can fit it into your pocket or into your purse, so you can revise anywhere on the go, somewhere where you haven't got internet access. Essentially what we've done is we've put hundreds of hours of research to summarize all the latest clinical guidelines, and it's just easy for you to revise. It'll help you with both AKT or CSA. So these are some of the things. Main thing really is for both AKT and CSA, allow enough time to cover the material, allow enough time to practice, to boost your exam technique. Put the work in, prepare, and you will succeed, okay? If you need any help or any advice, contact me through Facebook or through the website www.emedica.co.uk. Always happy to help assist people, whether you're sitting for your first time or you're resitting, I can point you in the right direction. Whether you're coming to one of our courses or using our online services or not, happy to offer free advice, so do get in touch. Thank you so much. All the best with your exams.